Good afternoon, everyone, and welcome to our webinar, How Can Digital Health Help Developing Countries? My name is Brenda Achere, and I'll be facilitating today's webinar. I'm currently working with MEDxeHealthCenter as the Operations Officer. As you all know, MEDxeHealthCenter is an e-health center for developing countries. And in the course of this webinar, you will hear more about the organization. I'd like to thank you all for giving us the attention and thank you for waiting. First, I'd like to cover a few organizational items with you all. Note that all participants are muted. If you have any questions, please submit them either through the question panel on GoToWebinar, Twitter at MEDxCenter with hashtag EHC questions. You can also submit them to our email info@medxcenter.net with the subject hashtag EHC questions. First, I'd like to thank you for the questions you submitted to date. These reflect vivid interest in the e-health topic, and we are happy to host this webinar and answer your questions along with our panelists. Some of these questions are: what is digital health and how can it be deployed in our countries? How can this work with limited resources? For instance, financial setbacks, infrastructural problems, know-how or learning. What would be the benefit for you as a medical professional? And how can your practice or hospital become a part of it? This webinar will answer most of these questions. Please feel free to submit more. Coming now is words from our founder. Please welcome Patricia Monte.
Thank you, Brenda. Thank you, everybody, for making the time for this wonderful event. Dear all, what an honor and pleasure to have you all around the awesome session that we've hosted and decided to host today. It's unfortunate I had to take over. As you saw on the agenda, the panelists were supposed to come first. We're still trying to get them connected, and we are sure we're going to get over this debate in a bit of a time. But first, let me tell you a little more about what MEDxeHealthCenter is and the why of MEDxeHealth. Why am I so dedicated to improve access to quality healthcare in developing countries? Well, I need to take you some time ago. When as a child, I experienced the threat of misdiagnosis up close and personal. I recall my sister having a seizure for being treated for typhoid when she was actually suffering from malaria. If not for an educated nurse in the neighborhood, she might have lost her life. This is the reason why I strongly believe that visibility and access to educated medical professionals and quality medical resources is critical for family well-being, for our economy, and for the well-being of all the society in many developing countries, just like in developed countries. And that's the reason why we need to make a change in that space. I also believe that as an entrepreneur, and I'm sure we have on the phone many entrepreneurs which I've seen on the list, we can make a fundamental change on the healthcare for developing countries and in developing countries. I myself had the luxury to get an education and to get a professional experience up to the level where I feel I can make a difference in this space. And this is, again, part of the reason why I decided to take up this challenge. We all know that education health are all important topics in order to alleviate and make a difference around poverty. But it's also good for ensuring a productive life all over the world, not only applicable for developing countries. Well, again, those are many of the reasons why I decided to take up this challenge together with Brenda and some more of the team members that are behind the scene, which you cannot see at this stage. And I would love to thank them for the awesome work that we've been putting the last months and that we are very pleased to present you today. So moving forward, we are going to take you through the different steps of showing you a bit how the market is behaving in terms of healthcare and technology. We will also share with you a little more about the strategy of MEDxeHealthCenter. We are not going to go into extended details, but we're going to stay as high as possible. If you have any question, as already mentioned by Brenda, don't hesitate to send them to us, either through Twitter or through the webinar platform, or even through email. Let's then move to the next step, which is what the trend around healthcare and technology looks like. I do believe that you've got the luxury to see what the latest number looks like, to see as well the power of technology, mainly in Europe and partly in America, because we believe that a lot has been happening the last years, the last decades in this part of the world, because we're currently located in Eindhoven in the Netherlands. A lot has been happening. We believe it's the time for the developing countries to pick up this challenge and to make a difference through technology in the healthcare industry. Moving forward, you've seen a lot about the why. You've seen a lot about what the market looks like. What is MEDx wanting to contribute into this whole story? So let's look into what we stand for. So what we believe we stand for is that we want to enhance health capabilities and opportunities for and in developing countries. Very critical words for us as an organization, because the in developing countries stands for making sure the local can get the right capabilities and opportunities when it comes to digital health, but we also believe a lot of tourists come in many of those developing countries. They would love to take advantage of those. What would it look like if one of our medical peer living in the Netherlands would visit us in Uganda tomorrow and would have the luxury, if he feels ill, to get the right treatment, just because the digital health is also available over there. Of course, there is a huge strength with mobile health, but let's take it a step further. And this is one thing MEDxeHealthCenter is committed to do. When it comes to the vision, our mid and long-term vision, what we aim for is to make sure that we establish ourselves as the key partner, the key provider in terms of e-health platform, again, for and in developing countries. We want to stimulate collaboration. We're going to get into the details behind this vision later. For the value part, what we believe in, what we strongly believe in, it's reliability of our services, it's commitment to innovate. Innovation is at the center of whatever we are doing. It's also ensuring that we have flexibility and respect for each other, because what you will see later is that we, through the platform, make sure that we stimulate collaboration. Now let's move to the 4 key elements that are critical in terms of what to expect from MEDxeHealthCenter. As I mentioned, 4 key elements when it comes to what MEDxeHealthCenter is all about. Think about this. Virtual availability. That's number 1. You need to remember when we talk of MEDxeHealthCenter. Second, integration of services and solutions when it comes to health provision. And compared to other competition, compared to many other companies doing into this space on the market, what we see is it's a one and the other service that is provided, while currently what we do is look at things from a patient point of view, ensuring that we provide an end-to-end, helping on one hand the medical professional through technology, so that the patient at the end can benefit from it. We're going to get in a bit of more detail later. Moving forward, the 2 last topics that are more related to robustness, efficiency, and the quality of the services and opportunities that we need to provide are the last topics that are very good to be brought up as key elements that are expected from MEDxeHealthCenter. What are we and what are we not? Because that's very important to highlight. Starting with what we are, of course, in the expectation, we already mentioned the 4. What are we? We advance healthcare, we enhance health capabilities, we enable North-South collaboration, we create opportunities, we promote visibility of qualified medical professionals, and we provide solutions to build even more robust healthcare systems. I think it's, again, highlighting what has already mentioned earlier in terms of expectation. The North-South collaboration may be a bit of a difficult word for some of our audience members. It's more talking about ensuring that we can create networking through technology between European, American, and the southern part of countries. It's also ensuring that the South-South collaboration can take place very well. What aren't we going to do? We are not going to substitute what is existing today. You all on the phone are mainly entrepreneurs, we've seen on the list, but there are also many medical professionals that join us today. You are doing an incredible job today. I mean, keep doing the awesome job you're doing. And we see, looking at the facts, the burden that is put on you, mainly in developing countries, with a ratio of 1 to 2 medical professionals for 10,000 healthcare seekers. I mean, it deserves an applauding. But we need to find a way to remove part of that burden by looking at how technology can help and support there. So we are not going to substitute what you're doing. We are going to facilitate, we are going to bring extra support in order to make sure that your knowledge is used in a proper way. We are neither a charity collector and nor are we distributing funds. We are going to make sure that we can provide a visibility for each of you through your capabilities to, again, create opportunities, but we are not providing any funds. The last part that we make sure we are not, Brenda and I are sitting here. What I haven't taken the time to provide to you is my own background, which is very business administration driven, and which is also partly information technology driven, meaning I'm no doctor. Brenda is neither a doctor. In the team, we do have some team members and some members of the management team having medical capabilities that's needed in order to drive many of our content, but we are not doctors. So we will leave that luxury to each of you. We make sure we provide the facilitation, the platform, and the place for your capabilities and knowledge to be served, to be used, and to be shared. Moving forward, I mean, I think it might be time to go. I mean, we've talked a lot about the what I always call the la la land, which is more the strategy and where our vision is going. What about the solution itself? How is it looking like? When you start typing www.MEDxCenter.net, what is that you can expect and how does it look like? So in order to explain this to you with the team, we've agreed to build two critical scenarios, because earlier mentioned, I said we're looking into an end-to-end solution where on one end you have the medical professionals, many of you on the call. On the other hand, we have the patient, healthcare seeker, as our legal advisor always advises us to use as naming, because patient doesn't apply in this case. Looking at the persona scenario of a medical professional coming on our platform. So what we've been thinking about, so imagine 1 second Dr. Faris being one of the person we've picked as our persona in this case, is interested to know a lot about malaria and wonder, where do I start? Because he's currently located in the Middle East. So she decided then to visit www.MEDxCenter.net because she's heard a lot about it when it comes to developing countries and therefore to tropical diseases. Although it doesn't stop at tropical diseases, we know developing country doesn't always meet tropical diseases. But that will be the first thought she would have. Then she goes on to the search engine, types malaria. What will happen is immediately she's going to get a selection of elements, whether it's in terms of scientific publication, illness, drugs existing, information, but the most important part, who is interested about this topic? Who are my peers across the globe that do like this topic, that want to do a lot about this topic, and that I can talk to in order to find out a bit more. So while searching, she will get all this contact. She will be able to connect with them, to discuss further, and to read even further. And this is where MEDxEHealthCenter, from a medical professional point of view, will be very critical. What I haven't mentioned is also the possibility to see what's happening around the malaria topic. Events happening around the malaria topic. These will be physical events, but just like we are hosting today, and we are very happy that many of you are joining and have decided to join, there will be a lot of webinars organized. Webinars organized by the MEDxCenter team in order to stimulate the collaboration, the sharing, and the knowing from each other. North-South, South-South, as well will be stimulated. And through those webinars, she will probably find out a lot. So moving forward, that was the medical professional persona. So imagine it's Dr. Faris going on the platform, searching for terms, based on the terms, getting a lot of resources, but also the possibility to start networking with peers being at the other end of the world. Now, then there comes the patient-driven, a step that we would love to make when our next publication will take place, because we're gonna go for a new launch in a couple of months, because we want to strengthen the healthcare seeker persona scenario. At this stage, what the healthcare seeker is provided with through MEDxEHealthCenter is the ability to view all doctors, the capabilities of the doctors around them. And this healthcare seeker can, as mentioned earlier, can be someone located on site in many of those developing countries, but it can also be any of the tourists visiting the place and suddenly not feeling well. So in our case, we decided to take the case of Aminata's mother, being one of you on the call. Imagine your mom decides to go on vacation to South Africa, and while she's there, she gets sick, she starts bleeding. She feels this is serious matter. So she decides to check with the medical personnel before pursuing the remainder of the trip. Through the platform, she takes an appointment, she finds out the doctor in the neighborhood, make an appointment, and decides to go there for a physical check. As mentioned earlier, this is only a piece of what will be delivered to the healthcare seekers, because the aim of MEDxeHealthCenter is taking it a step further, where we'll provide beyond the visibility possibilities to do payment online through mobile applications as well, or mobile phone, but also the possibility to make the appointment with each of you if they find you, the possibility to even get consultation via their phone if needed. There is more to come, let's put it that way. And at this stage, I don't want to disappoint, because otherwise expectation is very high. At this stage, we want to make sure that each of you, being doctors on the phone, can be visible, because that visibility we feel is not fully there yet. Although you have incredible knowledge, you have incredible capabilities that need to be shared, and we want to take the challenge to share it and to share it and share it, so that 24/7 it's available to anyone desiring to know who are those people that can make my life move ahead if I'm not feeling well.
Thank you very much, Patricia, for this very informative presentation. It was really great. Coming now is the panel discussion. We promised you. This panel discussion is going to be presented by doctors like some of you from developing countries who have also worked in various parts of the world. They all recognize also the huge potential and opportunity regarding digital health trends. So we are much obliged to them for sharing these findings with you all. Having said this, it gives me great honor to introduce to you Dr. Ezeilo, a multi-award winning family doctor, our lead panelist. Please welcome Dr. Ezeilo.
Okay, thank you very much. Yes, it's really a pleasure and an honor for me to be part of what this whole thing is supposed to highlight, because this is something that we're trying to introduce, this platform to developing countries, isn't it? Electronic healthcare. Okay, well, the first question I'd like us to discuss, gentlemen, is about e-digital health. What does it mean to you? What does it look like to you? When you hear that term, what kind of picture comes up in your mind, as in how you see this playing out practically?
Hello.
Yes, hello.
Talking briefly about the e-digital health, talking about e-health. It's very simple and let me say a precise way of just adding electronics health to health practice in whatever location you are. And because of the century, let me say the century, or the advancement in technology, mobile technology that's available, it has become something that is readily available for almost everybody that carries around a mobile phone that has GPRS access, a mobile phone or a mobile device that can connect easily with the internet. So it becomes something that has been relatively easy over the past couple of years. Talking about Nigeria, I would say since the introduction of mobile phones in Nigeria in the year 2002 and the advances that followed, the digital media generally has gone far in terms of development and in terms of accessibility and availability to individuals in the country.
Hello? Sorry, what was the last thing you said? It wasn't very clear.
Okay, I said since the introduction of mobile networks in Nigeria,
Yeah.
yeah, the advances in digital, not only in digital health, in digital media generally, has improved over time, affecting almost all aspects of human life in Nigeria.
So do you reckon that a lot of people have access to digital media?
Yeah, I believe so.
Back there?
If you check the number of Nigerians on social media, social networks, you realize that a lot of people daily or hourly or per minute are always on the internet. So what they are now using the internet access they have for is now what will decide what they will gain. If you are using it to search for health information, fine. But if all you are doing is just connect with your friends and family.
Yeah. So it'll be just a matter of making them aware that there's this other use for digital media than just whiling away the time online, huh?
Yes, yes. Even adding to that, in my practice, most young people that I see, I easily or readily tell them to use most people around carry BlackBerry phones. So I tell them that instead of just using the BlackBerry Messenger or WhatsApp Messenger, whatever that you feel, the symptoms or whatever the doctor say or the nurse tell you that you have, just type it to Google. You will get enough information. Whatever you don't understand there, write it down, come to me if we need to discuss it. Yeah.
That's actually a very good use of, that's a very good way to get them aware of this sort of platform, is by signposting them to what's already available. And from what Patricia said, with this platform there'll be access to information, so we'll be writing articles and uploading it, isn't it? And because we come from these backgrounds, we'll be, we're more kind of aware of what's relevant to the population back there. So that's actually awesome. Thank you for that response. And to my other colleague, what's your opinion on digital health or e-health?
E-health.
What do you understand by it?
Okay, basically, digital health, it involves the use of information and communication technologies in order to help address health problems and challenges faced by patients, who we see every day. And when you come down to e-health, we're basically talking about the use of text messages, like Dr. Afolabi said, the average Nigerian cell phone, mobile phones, iPads, tablets, as in it's on the increase. People are always buying every day. So you find that the number of people with access to digital technologies is actually on the increase. So I feel for e-health, we can actually leverage on this through the medium of sending them SMS, that is text messages, health issues. You can browse. Like in my practice now, most of the young people come in, like they already have an idea of what they have as in their problems, but because they are not medical professionals, it's not so clear to them. At times they come, a doctor, I have this, I have that, and I went online, Google told me this, as in, can you really explain more to me? Then I'm like, wow. So it's like, you already know what's up. Then it's like a mini lecture begins in the clinic, trying to break down the whole thing, as in what the person has, to make it more understandable. Then, like Afolabi also said, I agree. A lot of Nigerians are on Facebook, they're on Twitter, they're on YouTube, they're on Instagram, Nimbus, any social site, name it, we're there. It's like nobody's lagging behind. So I feel this is actually a nice way for us to leverage on this and make more people health conscious. Like this Ebola outbreak now, using this one for example, is like everybody now knows about Ebola, even more than the doctors themselves. It's like 247. This person is on Google, is on Wikipedia, asking questions. What's this?
Mm.
What's that? What's that? You find out that the health consciousness level is actually on the increase, and I, with the right, how will I put it, maybe awareness or how will I put it, like call it advertisement. I don't know. People will just come to embrace this concept of e-health. That's what I think.
Yes. Yeah, I think you're absolutely right. And personally, one thing I particularly like about e-health is because, well, for me, what it means is, as you've said already, using digital media, be it texting or the social media, YouTube and everything like that, to help these patients, to provide information, right? But also, I see it as a way of having consultations with them, because like in my practice right now, I don't only see patients face to face. Sometimes I'll have a phone consultation with the patient, sparing them a visit to the clinic. You see, so there are certain things that you can actually we can actually do for these patients that would avoid them having to go all the way to a clinic, which may not be nearby to them anyway. There are certain conditions that we can, whether we call it telephone triaging or telephone consultation, that there are ways we can
Okay.
actually help people and save them the panic or the need to visit a hospital or a clinic. So that's one thing. And another thing I like about this platform, especially as it's becoming more accessible to people everywhere, who have mobile phones and tablets, as you rightly said, it is the fact that many non-communicable diseases are lifestyle related, and these diseases,
Yeah.
like diabetes, high blood pressure, raised cholesterol, these things are lifestyle diseases with very serious consequences if very serious complications if they're not managed properly. So this platform, I believe, is people into doing the right things, the right lifestyle behavior, so that they can manage, and in many cases actually overcome those diseases, so that they can, lead healthy lives and avoid the complications. So there's a lot of potential here for e-health, and for a global e-health center like MEDx is launching. So it's quite an exciting prospect for us in developing countries. And then the next thing I want us to just talk about is, okay, we on the panel, us medical professionals on the panel, we obviously get it. We obviously get the vision and see how this could work. But do you think that the majority of our colleagues, medical professionals in general, do you think they're ready for this, for this next step, next level of healthcare? What's your impression from where you are right now? Dr. Ikpe, up to you.
Okay. Thank you. Whether our colleagues are ready for this next step or generation of healthcare. Personally, on from my practice, we're in Nigeria here, and most times, in as much as medical healthcare is we are out to solve people's problems. On the other side, it's also a business,
Mm.
so money is coming in by the side. So in as much as you're treating patients, you're collecting your money on the other side. Now the question becomes, if we're going to be doing e-health,
Mm.
doing consultations online, especially maybe for NCDs, that's non-communicable diseases per se, we find that it's actually going to take a large chunk of the patients that will go to the clinic.
Yeah.
Patients will only go to the clinic if they all are calling out serious condition that warrants them going to the clinic. So you find out now the how will I put it now, patient attendance to clinics is actually going to
Mm.
drop with this. And I don't think on a personal level, I don't think our
Which is
colleagues
good.
down here are ready. Yeah, it's good, but I don't think they'll be ready for that. Because like every patient that comes, somehow you get to pay money, do some couple of tests and all that. Even when you see a doctor in his clinic, I mean, you pay consultation fees. So the question becomes, okay, this guy you're seeing online, how does he get his money? Because you find out it's not every doctor that is actually charitable to be doing free
Yes.
consultations and all that. You get most of them, they are like, okay, you spend so years in school, so many years in residency, postgraduate studies. I mean, how do you now make up for that by doing charity work? You get that is a big issue, actually. Yes. So personally, maybe a few people, maybe like me and some other guys out there may be ready. But I think a large chunk, especially the older generation doctors, they may not actually
Yeah.
embrace this the way it's coming. That's what I think.
Fair enough. So basically, you're saying that um, the vast majority, well, the majority of our colleagues may not immediately embrace this because they'll see it
Exactly.
as a loss of income. That's the bottom line,
Exactly.
right?
Sure.
So what makes you embrace? What has made you
Hello.
embrace it then? Yeah. Did you get my
I can
question? I
hear you.
said,
Come,
what
come
has
again.
made you
Come
embrace
again.
it then?
What has made
You
me
know how you
embrace it?
said many of our colleagues will see it as a loss of income. Yeah. What
Yeah.
makes you embrace it?
On a personal level, again, I'm just speaking for myself. Um, Before, like I
Sure.
told Brenda, I was actually working on something like this before this whole thing popped up, my email and all that. I was looking at avenues to be sending
Okay.
out messages to people, yeah, the major networks here we have in Nigeria. So I was working on that.
Mm-hmm.
Then secondly, I don't really depend on my medical practice for my living as per income. So the
Ah.
money I'm
Oh,
making is
that's
not
good.
actually strictly medicine consultation. Fine, like I'm into event management, covering
Okay.
weddings, events, and all that. That's by the side. I'm also into business, buying and selling medical equipment, and all that. So somehow, some money is
Ah,
coming
so
in
that's
from
your
different
secret
sources.
then.
So exactly. So I'm not really looking at medicine as far. Okay, this is where my, as in my whole life
Yeah.
is going to be tied down. So it's actually makes me a bit more flexible when it comes to issues like this. Okay, I can say, okay, why not? I can
Yeah.
give free consultations. We go for medical outreaches. Nobody pays us. We
Mm.
spend our own money on transportation. You lodge yourself. You feed yourself. At the end of the day, I
Mm-hmm.
mean, it's like the only gain we have is the look of satisfaction on the patient's face. And when they tell you thank you
Yes.
for coming, I mean that's enough for me. Everything is not actually about money. So find out those that are actually entirely
True.
tied down to the practice will not see the way I'm seeing it. So I think that's what made me embrace this.
Mm.
Yeah.
Yeah. Okay. That's brilliant actually. That's brilliant. Thank you for your answer. Dr. Afolabi, what do you think? What do you
Uh,
think about our colleagues in
yeah,
general? Yeah.
it depends on the settings in which you are working. There are two basic settings in Nigeria
Mm-hmm.
where you can work. Either you are in the privately owned hospital setting or you are in the government hospital setting. I work in the government hospital, so
Right.
I get paid at the end of the month. But
Yeah.
I don't do a phone consultation. If you call me
Okay.
that you have an issue with your health, blah 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 blah, I'd rather give you an appointment to see me in clinic. I'm not going to collect
Yeah.
any money from you. Any money I'm going to
Uh,
pay you to just
uh-huh.
but but I notice something over time among people. We misuse information. That is the reason why I don't do phone consultation. I can tell you, hey,
Say
on
that
the
again,
phone,
sorry.
that we misuse information. That's why I don't do phone consultation.
Okay.
I can tell you
Okay.
A on the phone, and you come back to me in 2 weeks time and tell me that I told you that. That was a phone consultation. There is no medical record to back up whatever I'm going to say. So it's going to be your word against mine. And people tend to be on the side of the patient or client more than on the side of the
Yeah.
doctor. That is the
Exactly.
reason why they look for consultation. The people in
No,
private
but
settings,
it's,
yes,
so sorry, I was just going to
hello,
say that even in phone consultation, you're actually taking notes as well. So you're,
yeah,
the same way you're taking notes when you're in front of the patient, even if you're remote from them, you have to take notes as well. So
yeah,
it's the
surely,
same.
surely, surely. But the problem with our system, if there is no physical consultation,
Ah,
it can easily be used against you.
really?
Seriously, it has happened a couple of times. It has happened a couple of
How
times.
about if we
But if
can
you are
get to
seeking,
record the phone consultation?
uh, well, well, if you are seeking advice
Uh-huh.
on an issue, I can easily be on
Mm-hmm.
help on phone. But if you are seeking treatment, I will give
Yeah.
you an appointment. So two things: if you are seeking advice, I can give you advice. If you are
Mm.
seeking treatment, you see me physically.
Yeah.
People in private practice. I could remember in 2006, I was working with a man that has a private hospital, and one of his patients, a woman, called him.
Sorry.
Hello.
Yeah, I'm here. Sorry.
Yeah, the lady was discussing what was wrong with her son with the doctor on phone. After the woman had said everything, the answer from the doctor was she has to come to clinic. Immediately he dropped the call. He now look at me and tell me, how will I be able to pay my staff? How will I be able to pay my staff? How will I be able to pay my bills if I have to be doing prescription on phone? That is another angle to it.
Uh-huh.
You understand?
Okay. So it's the same
What
thing with
people
money
can
again.
do, yeah, what people can do is to seek information themselves on the internet concerning whatever symptoms they have. You understand? If you
Mm-hmm.
seek the information, you be more enlightened and you have the right knowledge on what to do next.
But the
Do
tricky
you
thing
understand?
about that is that when people go seeking information, they without guidance,
Yes,
they very often, I
yes,
mean,
yes.
I've had people, and I'm happy for people to seek information. That's not a problem. But without guidance, they go and get the wrong information. The
Yes,
information they get is not applicable, and so they
that
get
is the
all
reason
panicky.
why.
Everybody thinks they have cancer once they have a tiny. Do you know what I mean?
Yeah, yeah.
So um,
I said earlier on,
that's the.
I tell them to check.
But
Yeah,
I'm still optimistic that you know the way using digital health to communicate with and to serve patients, I think that it's still, I think it's something that can be done, that can succeed even in developing countries. People just need to adjust their perspectives or their mindsets about these whole things. For example, one thing that the two of you said in common that can be an obstructing factor with our colleagues is the whole monetary side of things, you know. So there's absolutely nothing, in my humble opinion anyway, there's absolutely nothing wrong with being compensated for your work, whether your work is being done digitally or whether your work is being done face to face. After all, it's your expertise that these people are benefiting from.
Yeah.
So
Yeah.
there are ways to monetize digital health. And because we're talking about a global platform here, the potential of big money for those that want to look at money is huge. You know what I mean? um, because of the global nature of the platform. So there are lots and lots of ways to monetize digital health, whereby a lot of people paying a very little amount each, it all adds up. So there are ways to monetize it, and I think it may be a matter of educating our colleagues to see those ways, to see that, listen, the fact that we're thinking digital health doesn't mean you have to close your clinic. It doesn't mean you're going to starve. It's just a different way of looking at things. And because of the reach, after all, in your clinic, because it's four walls, face to face, how many, let's just say 8 to 10 hours a day, for example, you can only see so many people per day that way anyway. Whereas in the digital clinic, in the e-health center, right, you can see a lot more people without leaving your home, without leaving your room in a shorter amount of time. So I think it might be a matter of educating our people, our colleagues, find out what exactly are their fears where this new technology is concerned. And then just helping them to see what we already see, the three of us on this panel, what we see, which is that this could actually work. This could actually help people who otherwise wouldn't access, say, clinics and things like that. It could actually be a way to help them. And then just brainstorm ways to monetize it. There's nothing wrong with being paid for providing digital health, I don't think. Just like there's nothing wrong with being paid for our face-to-face consultations. It's the same thing we're providing, just that it's digital. So there's no crime being paid for it. After all, as you said, you went to training, you went through all those years of training, paid all those fees, did all your residency, not to come out and do charity.
Exactly.
It's nothing wrong with doing charity, but I'm saying that it is possible to make a living off of it if that's what somebody wants to do. I think we should just be open to that possibility. But that's my opinion anyway. So in what ways do you think digital platforms could help to improve access to healthcare in developing countries? Because that's what this is. That's really the crux of what this is about. It's like a health center, but a digital one. So meaning that as much as possible, the things that people would benefit from in a live health center, as much as possible, how can we provide that sort of thing in a digital platform? So in what ways do you think that it could help improve health access to healthcare in developing countries? Dr. Afolabi, what do you think?
It depends on the information that you search for. It depends on how well you interpret and how well you are going to use that interpretation of your information that you do.
Yeah, that's the thing, and that makes it a bit tricky if it's left for the patient to read information and make something of it. But what I do see, though, I'll get to you in a bit, Dr. Ikpe, but just wanted to say this here, is that with the e-health center, what I see as a possibility is where people are aware that there are these doctors available for initial consultations, whether it's by phone or online or Skype or whatever, Facebook, whatever, And when they've had the initial consultation, so like, for example, this lady, the patient that you've just talked about now with the breast symptoms, right? In that phone consultation or Skype or whatever consultation it is, we will then tell the patient that they need to be seen and physically examined by a medical doctor. And hopefully what I'm seeing or hoping to see is like there'll be a network of kind of local doctors in the various developing countries that are working with MEDx, so that we can refer people to them when when they have these kind of symptoms that need physical examination to ascertain what's going on. Exactly. Does that make sense?
Yes.
Dr. Ikpe, what do you think? How do you think digital healthcare could help?
Well, for developing countries, let's talk of general anyway, you find out that there are certain, I call them characteristics that are familiar or similar to them. You have cases of extreme poverty, you have a high population, you have a high disease burden, then you find out at the same time there's a low health care workforce. Rural areas are large and they are basically resource poor areas, and there is almost practically non-existent health information systems. So it's actually a big problem. But coming to the e-health benefits to developing countries, like we said earlier, now the number of people, mobile phones and all that is actually on the increase. So like you mentioned, the non-communicable diseases, they're actually on the rise more than the communicable. When you talk about DM, hypertension, HIV/AIDS, hepatitis, and the rest of them, they're actually on the increase. Lung cancer, liver issues due to alcohol, smoking, and all that. So for us, I think through e-health we can actually enforce lifestyle changes, as in like trying to create awareness. Like saying through the e-health we can be able to reach out a large population. I mean, you need to
Okay.
cut down alcohol. If you're diabetic, these are things you need to do. Avoid this, avoid that. You mentioned initial consultation to see a doctor. I mean, somehow it's good because like in some areas maybe the nearest clinic to someone is like
What did you
three
say?
4 kilometers away. I mean, when they think about the stress, okay, I'm going to enter transport, sit down for hours before I go and see a doctor. I mean, they're like, come on, let me just stay at home and chill out. Anything that happens, let it happen. Do you understand? But once they remember, okay, fine, I can actually log in from where I am and see a doctor face to face, online consultation for an initial consultation. Okay. We talk online, then I tell you, okay, man, you need to go and see a doctor for he or she to actually examine you. So that person can actually plan, okay, next week, book Monday, I'm going to make a trip to go and see the doctor. So it makes it easier. You've allayed the person's anxiety. At least he has an idea of what's happening and the need to actually go and see a doctor physically. But one thing I've understood that most people don't actually see the need to do certain things. Like I said before, the gap between what people know and what they should know is actually very wide. And you find out when they understand this is why I need to do this, you actually find them going to do that. Like most of my patients in my own practice, talking about HIV, hepatitis B, I tell them why they need to know their status. Before you know, they are like, okay, where can I do the test? I want to do, because they've understood why they should know their status and all that. That's for that one. Then I think about it like e-health now, just like we were talking online now. It's actually maybe a good ground for communication and training of healthcare workers. Maybe you are over there, I'm here in Nigeria, maybe somebody is in Senegal, somebody is in Guinea. We can actually come together like this, talk about certain issues, maybe latest trends or techniques in the management of certain illnesses and things like that. So it actually saves you conference time. So, okay, there's so and so conference happening there. I'm starting, okay, how am I going to afford my flight tickets, hotel accommodation, and all that? So, but if you're actually online here, the only thing you need to do is just get a laptop and your modem, and I mean, you're getting all the information you need online. And after this, everybody goes to where you want to go and start practicing what, how will I put it, you learned
Oh.
online. Then I also
Oh, there.
see it as a, though I've been thinking anyway, like probably sort of a feedback platform from the patients. Maybe somebody consults a doctor online, and after everything, you're able to, let's say you make a diagnosis or whatever, he goes to see the main doctor and all that. I think it's actually a way of maybe tracking diseases, or I don't know. I was just thinking in a bigger picture, sort of maybe I talk to somebody, okay, it says they're non-hypertensive and all that, maybe diabetic. Maybe I think maybe there should be somewhere where the person can actually log in, maybe diabetic or something, triggered. So in a long term, we can actually track, okay, from Nigeria, so and so area, this is how many people we've
Mm.
actually seen that are diabetic, this is how many people we've seen that are hypertensive, maybe from Guinea, Somalia, as in all over the world. So somehow
Yeah,
it's
that's
like you can
yeah.
collect data, really help in research, so that when you're talking about something, say yes, you're talking about facts because we have statistics for people logging in, feedback, and all that. I think it's a good one.
Mm.
Then I also thinking about how would I put it? Maybe disease tracking. I don't know. Maybe I think too much. I don't know. Something like disease tracking per se, like this Ebola issue we are all battling now. Let's say, for instance, you see somebody features of Ebola and all that, you can actually log in and say you've seen so and so somewhere. So the MEDxCeHealthCenter actually is like tracking where the feedback is coming in from. So maybe during outbreaks, cholera or whatever, even the healthcare workers down there, they are on ground seeing those people there. They can actually give a feedback to the center. So like we are saying, okay, fine. Oh, Somalia had so many doctors, so many cases of how many cases of cholera and all that. At the end of the day, we can actually sit back and say, okay, this is what the disease pattern is like. Do you understand? Like maybe it gives you to maybe push for further studies or something to study diseases and all that. Yes. So I think these are some of the benefits of e-health to developing countries for now.
I think that's actually a brilliant angle for this whole thing, because in doing that, obviously, we're improving our knowledge base as well, you know, with
Yeah.
which we can use to help patients even more. So yeah, that's actually an excellent way to do it. I also think that, the e-platform, the digital health platform is a great one for educating, for raising public awareness, health promotion and things like that, whether it's in terms of webinar, educational webinars or seminars and things like that. So, and also educating each other, having educational conferences for ourselves for our own professional development as well. There's just a lot of potential on how the platform can be used, and I think that um, the more aware people become of this possibility, or of this platform, the more likely they will be to make use of it. So that's what we hope to see happen in future. Brenda and Patricia, it's over to you.
Number of questions coming in from the audience, so we're going to take the questions now. The audience is asking if doctors will have electronic prescriptions uh, on in local pharmacies that they can tap into once in a while to get the medications or something.
Well, I mean, I don't know if from a platform point of view, technically, we're planning, and I've heard it throughout the discussion. So I've heard a lot about networking among different doctors across the developing countries. That will definitely stimulate. But that also means that Dr. Ikpe, Dr. Afolabi, they all need to be part of the platform so that other peers in different countries can see them. So we will engage highly as a team and as an organization, making sure that all doctors available there in first, and of course the 13 countries we are targeting, that they are visible, that their profession is visible, and that will stimulate the networking. Next to that, what we want to do, and again, I've heard a lot about the financial issue, which we are working very, very hard on that with the team, making sure that we can find, again, it's not finding funds, but we have smart ways, or we call it new business models, in order to figure out how to get to you, medical professional in developing countries, the right amount of money so that every single person locally can get proper treatment. Now, there are loads of formats in which it can be done. You've mentioned the pay-as-you-go model earlier, Dr. Ikpe, and there are many others forms that we will come up with during our next launch, which will be announced pretty soon to each of you. What you shouldn't forget neither when thinking of the platform is we will provide an appointment, a possibility to do an appointment online, but also making sure that we have online consultation. And the online consultation, I mean, it seems to be a skeptical topic at this stage, but at the end of the day, before any online consultation, payment is a tricky topic. Visibility of the medical professionals with their capabilities and the right and strong capabilities, who to trust, who not to trust, which we'll try to ensure through, we will make sure we ensure through the platform. They are all elements that will already be tackled by the platform. On top of that, and that was what the question was all about, the data of the patient, when it goes through to online consultation, or if he decides to work with one doctor, especially in our network, will have the possibility to own its own history digitally. So through the platform, we're going to provide a service where Every time you go to a doctor, whatever is the doctor, patient owning his own credential will be able to follow and see what has happened, why it happened, and what are the drugs that are advised by the doctor for him to take. Now, is it going to be linked to a specific pharmacy? Being honest, at this stage, we haven't thought through it, but definitely something to consider. So thank you to the person that asked the question. We're going to look into that.
And we hope it's clear for now. We're going to get back into that. We have our next question. What would be the benefit for medical professionals, and can their practice or hospital become part of it? I think this is the question she just answered, and she said a minute ago, the consultations online are not free. They are going to be paid. I don't know if that's what you mean. So this is another kind of health provision where you get paid, but the only difference is it's digital.
Okay.
We have a next question coming in. What is digital health and how can it be deployed in your countries? I think this, with all the presentation, this was talked about, and if there is more to draw light on, Patricia can explain that more.
Technology, technology, technology. We need to find a way to use it and use it as much as possible in our advantage. Again, facts shows us 2 medical professionals for 10,000 locals. That's without counting all the tourists that come towards developing countries. We count around 50 million tourists on a yearly basis towards Africa, 100 million towards all developing countries. How do we make sure that we serve almost everybody when something goes wrong? Out of those, around 30 million are somehow dead on a yearly basis. Well, looking at the latest statistic, do not manage to get a proper health care because there are not enough health professionals. How can we make sure that through technology, wherever you're sitting in the world, if we can leverage with doctors in India, we can leverage with doctors in the city versus the one in the rural area in order to save the life of 1,000 people, independent of the financial issue, which again, through the platform, we are committed to find a solution to, because there are couple of ways to deal with that. There is no other thing I can add on that. Technology, 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 plus the capabilities of all medical professionals. And that brings me back to what I've said earlier. We need to make sure that medical professionals are visible, available, willing to share, and willing to talk with each other.
Thank you very much, Patricia. Having said that, we have covered all the agenda.
So, what else can I say? Join us. That's all I would say. It's very, very critical. Your presence online through the MEDx channel is very critical. Join us to make yourself visible, but also to start interacting with other medical professionals and healthcare seekers through the technology. As mentioned earlier, the capability is already there. It needs to be brought forward. It needs to be present online. As you've seen in one of the videos, it's becoming the third country in the world with the population only looking at Facebook. We need to take advantage of that. We shouldn't be behind as developing countries. It will be a missed opportunity. That's what I believe for any of us if we are not jumping on the boat now. We offer you, and this is talking mainly to medical professionals. As mentioned earlier, we can network, we can be present, we can talk with each other through webinars. We offer you the possibility and the choice to share your knowledge. And those knowledge, whenever you want, at the end, I'm going to share with you some of our details. Come to us if you have a topic which you believe can be beneficial and can be critical for other peers in the medical field to join many of our webinars. After my piece of the speech, we will have our panelists sharing their thoughts, all being doctors, around the topic of digital health and developing countries. And I think many of you could do just the same, related to different topics. So don't hesitate to come back to us in case you're interested to join and to speak. We also provide a space for sharing articles. Any articles you believe you want to share, you love writing, don't hesitate to join the network and do that. But at the end of the day, we need you to be visible on the platform. So thank you very much. Last piece I want to bring to you is all our contact details, which I'm sure each of you will get once we send you a copy of this slide deck. So send us emails, and we will get back to you as soon as possible. Thank you, Brenda. Thank you, the audience, and I wish you a great day.